Welcome to the Skagit Regional Health Total Joint Education class. My name is Kay O'Neill, and I am a physician assistant in the orthopedic department at Riverbend Clinic in Mount Vernon. Now that you and your surgeon have made the decision to have a joint replaced, our highly trained staff is here to help you every step of the way. The purpose of this video is to help you prepare for surgery, understand the hospital stay, and recover well at home. You may follow along with us in the Total Joint book you received at the office. Today we will discuss general information about having joint replacement surgery, preparing for surgery, what happens on your day of surgery, the hospital stay, pain management after surgery, and rehabilitation. Create realistic goals for yourself after surgery can help you stay on track during your recovery. We hope the handbook will help guide you through the process. Throughout the book, there are places for taking notes, checklists to help you prepare, and medication trackers at the back of the book. After surgery, it is important to stay healthy and avoid unnecessary procedures. We'd like you to avoid dental work, including cleanings, for 6 months after surgery. If you develop an infection anywhere in your body, it can get into the bloodstream and infect your artificial joint. You may need antibiotics before certain procedures, such as a dental cleaning or other surgeries, period. Our office is happy to prescribe antibiotics before dental procedures. It is usually 1 dose an hour before your dental appointment. Once your dentist knows that you have an artificial joint, they may do the prescription for you. Please let us know if you would like us or your dentist to prescribe the medication. We recommend antibiotics before dental procedures for 1 year following your joint replacement. Proper nutrition can help your body heal after surgery. With the proper nutrients, it can help promote wound healing and avoid surgical complications. If you are a smoker, reducing or stopping smoking before surgery can help improve wound healing and decrease risk for anesthesia complications. If you are diabetic, keeping your blood sugars under good control will help with wound healing after surgery. If you take insulin, please let your provider know how much insulin you take on a regular day. The stress of surgery may increase your insulin needs for a few days. We will continue your insulin sliding scale while you are in the hospital. Questions for your insurance company. Every person has different covered benefits depending on their insurance plan. We suggest that you contact your insurance company and ask some of the following questions. We will provide you with the diagnosis code and the procedure code for your particular surgery. Do you have an insurance claim or case manager? If you do, record their phone number in your total joint book. Does your insurance cover durable medical equipment such as walkers or a raised toilet seat? Do you need to obtain the equipment from any vendor, or do they have a specific vendor you must get it from? Skilled nursing facilities may be covered generally by your insurance, but it may not be specifically covered for your joint replacement. Please ask if a skilled nursing facility is a covered benefit for your particular surgery. Also, is home health an optional coverage for your specific surgery? Your surgeon may prescribe physical therapy after surgery. Is this a covered benefit, and for how many visits are you covered? Also, find out if you have co-pays for any of these procedures. Finding out this insurance information prior to your surgery helps you to avoid unnecessary costs. Having a health coach can help decrease some of the stress and anxiety you might feel going into your surgery. Your health coach should be an active partner in your care. They may be your spouse, a family member, a friend, or a neighbor. Ideally, this person will be able to attend appointments with you both before and after surgery. They can help take notes at your appointments. They can help you prepare your home so you're ready to come home from the hospital. They may assist you with physical therapy exercises or provide transportation to and from the hospital or your therapy visits. They may help you with activities of daily living when you return home. Operative testing. To make sure that you are medically stable for a major elective surgery, your surgeon may order different tests such as blood work or EKG. You will have had x-rays or other imaging prior to your pre-op appointment, which helped your surgeon determine the severity of your condition and help him determine which kind of implants would best fit your anatomy. We usually get blood work done within 2 weeks of surgery. It may include a blood count, chemistries, a hemoglobin A1C, or a COVID test. An EKG may be ordered if you have not had one recently. It is where electrodes are placed on the chest to record the electrical activity and rhythm of the heart. This information is very important for anesthesia. Sometimes you may need additional cardiac testing, such as an echocardiogram. We will let you know when it's time to have the different tests accomplished. Preparing your home before surgery will cause less stress when you return home from the hospital. There are many simple things you can do in the house that will help with your recovery and decrease the risk for falls. The first thing is to remove all throw rugs. A walker can catch on the throw rugs, causing you to fall. You want to arrange your furniture in the house to accommodate the walker so that you have an easy, clear path. Make sure the furniture you are using will be sturdy and has armrests so it is easier for you to get up and down. If you can, try and stay on a room on the main living level with a bathroom to minimize going up and down the stairs every day. Have a nightlight in the bathroom and in the hallway to light your way to the bathroom in the middle of the night. Install handrails on indoor and outdoor stairs. If your stairs tend to be slippery, apply some non-skid strips to the stairs. On your walker, you can attach an apron with several pockets to hold your cell phone, TV remote, or a water bottle. Stock up on easily prepared nutritional foods and keep some regularly used items within easy reach, such as a throw blanket. During your rest time, you may want to have some hobbies to keep you busy. You may want to have some books, puzzles, an electronic reader, or the TV near you to distract you when you are resting or icing. Be aware of pets when maneuvering in the house. Obtain durable medical equipment before you come home from the hospital. This may include a front-wheeled walker, a raised toilet seat, or shower seat. Starting 2 to 4 weeks before your surgery, make sure you have clearance from any other providers if needed, such as cardiology or your primary care physician. Begin preparing the house. Complete the preoperative tests that have been ordered for you. Find a location for physical therapy if that has been ordered for you. We will provide a referral for you on the day of your preoperative visit. A week before surgery, determine who will give you a ride to and from the hospital. Please fill out the PT-OT questionnaire on page 29 in your total joint book. This information will help your therapist in the hospital customize your exercise program for your home needs. 1 to 3 days before surgery, the surgery department nurse will call you to verify the time that you need to be at the hospital for your surgery. They will review your health history and review your medication list. They will let you know if there are any medications that you should take on the morning of surgery. You will start your skin preparation with the chlorhexidine wipes. Do not shave any part of the body for 2 days before your surgery. Change your sheets and wash your pajamas. You may shower the night before surgery, but do not apply lotions, deodorants, or powders. Do eat a light dinner on the night before surgery, but do not eat or drink anything after midnight, except the medicines that you have been instructed to take. To help decrease the risk for infection, your skin preparation leading up to surgery is very important. You have been provided with 3 packages of chlorhexidine wipes. These are disposable and will be used only once. The first wipe will be used to clean the neck and chest area, and then discard the wipe. The second wipe is for both arms, starting at the shoulders and ending at the fingertips. Be sure to thoroughly wipe the armpit areas and between the fingers. The third wipe is for the right and left hip, followed by the groin. Be sure to wipe in the skin folds of the lower abdomen and groin area. Do not wipe the genital area. Number 4 is for both legs, starting at the thigh and ending at the toes. Be sure to wipe behind the knee. Number 5 is for your back, starting at the base of the neck and ending up at your waistline. You will definitely need help with this one. Number 6 is for cleaning the buttocks area. These wipes are not flushable. Please dispose of them in the trash. Do not wipe it off. Allow it to air dry. You will not bathe or shower or rinse the skin after using the cloths. After the solution has dried, you will put on clean pajamas and sleep in clean bedding. The next morning, you will do the same thing. When you check in at the hospital, the nurses will do a third skin preparation. Your hospital packing list. Wear loose, easy-fitting clothing that is easy to get on and off. You may bring your own toiletries, but we have most of them available at the hospital, such as toothbrush and toothpaste. If you wear hearing aids, please bring extra batteries as well. If you wear dentures, please include a case. Don't forget your glasses. If you use a CPAP machine to help you breathe at night, bring it with you to the hospital. You will use it when sleeping. We have distilled water for your CPAP machine in the hospital. Bring something to occupy you during your quiet time, such as a book or electronic reader. In terms of paperwork, bring your joint replacement book, insurance information, medication list, and any advanced care documents such as a pulse, living will, or durable power of attorney. Do not bring medications, money, jewelry, weapons, or any items that have fragrance. When you check in at the hospital, please arrive at your appointed time. At Skagit Valley Hospital, you will go to day surgery, which is on the 2nd floor. When you come into the main entrance, the elevators are right there. Take them up to the 2nd floor, and you will check in at day surgery. When you check in at day surgery, please give them the name of your health coach and phone number, so the surgeon may call them after surgery to let them know how you did. At Cascade Valley Hospital, you'll enter through the main entrance and check in for registration there. In the hospital waiting room, there will be a monitor on the wall indicating the status of the patient, and a special code will be given to the family member. COVID restrictions, the waiting rooms are currently not being used. Family members must wait outside and wait to be called by the surgeon for updates. A nurse will come and take you to a preoperative room to get ready for surgery. You will change clothes into a hospital gown. They will take vital signs, and the nurse will review your medical history. They will start an IV and do one final skin preparation. The anesthesia doctor will talk to you about your anesthesia options. Your surgeon will meet with you and put their initials on the surgical site. Your anesthesiologist may talk to you a day or two before your surgery, but you will have a face-to-face conversation on the morning of your surgery. You will discuss your anesthesia options. General anesthesia is anesthesia that acts on the brain and nervous system and renders you temporarily unconscious for your surgery. You are not aware of anything going on around you. A regional block includes a spinal anesthetic or a nerve block of a particular limb. A spinal block will numb you from the waist down, so you cannot feel the surgical area. You may also have a light general anesthetic to accompany that, so that you are not aware of anything else going on in the room. Your surgeon will apply local anesthesia at the surgical site. You and your surgeon and anesthesiologist will decide together which anesthesia technique would be the safest for you during your surgery. If you or any family member have ever had a problem with anesthesia with any surgery, please let them know ahead of time. Tell your anesthesiologist if you or anyone in your family has ever had a very high temperature during or after surgery, or any other problems with anesthesia, such as slow to waking after surgery or prolonged nausea and vomiting following surgery. Waking up after surgery. You will wake up in the post-anesthesia care unit or recovery room following your surgery. The recovery nurses and anesthesiologists will monitor you and your surgical site. When you wake up from surgery, you may be confused, have chills or shivering, nausea or vomiting, or itching. You may also find many things attached to your body, such as oxygen on your nose or mouth, a catheter in your bladder, a drain in the surgical site, ice packs on the surgery site, electrodes on your chest to monitor heart activity, an oxygen sensor on one of your fingers, a blood pressure cuff on your arm, a pillow or foam wedge between your knees to prevent you from crossing your legs after hip surgery. There may be a brace on your leg. There will be sequential compression devices or compression stockings on your legs. Do not grab or pull on any of these devices. After surgery, there are many things that can help you recover well. A simple exercise such as ankle pumps helps to prevent blood clots and reduce swelling by increasing circulation in the lower legs. TED hose or compression stockings are tight-fitting stockings that help to support the muscles, control swelling, and prevent blood clots. Early walking is important to help prevent blood clots. Your nurse or physical therapist will get you up out of bed and on your feet as soon as possible after surgery. They will often have an ice pack on the surgery site to help decrease pain and swelling. When icing at home, you will always place a towel or cloth between your ice pack and your surgical site. Because you had anesthesia during your surgery, you will need to exercise your lungs after surgery. You may be encouraged to cough or do deep breathing exercises, or have a little machine called an incentive spirometer that measures how much work your lungs are doing. The most common cause of fevers after a surgery is not exercising your lungs enough. DVT, or deep vein thrombosis, is when a blood clot starts in a blood vessel of the leg. It can go to your lungs and kill you. To prevent that, we do many different things. One is getting you up moving right away. 2 is wearing compression stockings. And 3, putting you on a medicine that helps to thin your blood so it flows easier. That may be something as simple as a baby aspirin, or it might be a once-a-day pill, or an injection medicine. Your surgeon will determine which one is appropriate for you. Preventing infection. Be a partner in your care. Anybody who deals with you in the hospital or at home should always have clean hands. They should be washing their hands or using hand sanitizer before they touch you. Hands should be washed after using the bathroom, before and after meals, or when anyone is entering or leaving your hospital room. Do not touch your wound with bare hands for 2 weeks unless you have been directed to do so by your surgeon. Any infection in your body can get into your bloodstream and infect your new joint. Bacteria is attracted to big metal objects like a joint replacement. An infection in a total joint can be a devastating problem, leading to multiple surgeries, long-term antibiotics, and a poor result from the total joint. Signs of an infection include redness at the incision site, drainage such as yellow or green in color and foul smelling, a sudden increase in pain for no reason. There will be some redness and warmth at the surgical area. Because of the swelling, the area is going to be warm, but infection, it would be bright red and exquisitely tender to the touch. Discharge from the hospital. Most patients will stay in the hospital for 1 to 2 days after their surgery. When you are able to get in and out of bed yourself, go up or down stairs if needed, and dress with minimal assistance, you will be ready for home. We also want vital signs to be stable and pain to be under good control. During your hospital stay, there will be multiple different medicines to deal with pain, and we want to find the one that works the best for you that you can go home with. That means we will be transitioning you from IV pain medicine to oral pain medicine as quickly as possible. Physical therapy and occupational therapy will see you during your hospital stay. They will help determine when you are moving well enough and safe enough to go home. At the time of discharge, you will have detailed instructions on how to take care of your wound, when to shower or change a dressing, activity level, and instructions regarding your medications. Your nurse will review all of these with you before discharge. Pain management is part of being medically stable after surgery. Everybody experiences pain differently. Tolerable pain level is the amount of pain you're able to handle at any point. We have multiple pain medications available during your hospital stay. This will help us find out which one works best for you for discharge. People react differently to different pain medicines. There are many side effects to pain medicine. The most common is constipation. Pain medicine reduces pain by slowing down your central nervous system. Your central nervous system is also in charge of your gut. Constipation is when your stool pattern becomes less frequent. The stool can get backed up, which can result in cramping and pain in your stomach. Please talk to your provider about which medication would be best for you. Things that you can do to help your symptoms include drinking a lot of fluids, eating foods that are high in fiber, such as fruits and vegetables, or drinking prune juice. You might need to take a laxative or stool softener. Getting up and moving frequently helps to stimulate the bowels to keep moving. Narcotic pain medications will make you drowsy. You may be so drowsy that you may fall asleep in the middle of speaking a sentence. That means the medicine might be too strong for you, and you might need to adjust your dose. We want you to be comfortable enough to do the exercise you need to recover well, but not so comfortable that you sleep all the time. Nausea and vomiting can result from pain medications. Nausea is discomfort in the stomach that makes you feel like you might want to vomit. Vomiting can take away the nutrients in your body and cause dehydration. Ways to help your symptoms include drinking lots of fluids, eating healthy foods. Foods that are high in fat are harder to digest, so keep foods plain and simple. Talk to your provider if your symptoms do not improve. Pain is an expected part of joint replacement surgery. Knee replacements tend to be a lot more painful than hip replacements. They're very different joints, and hip patients tend to get better faster. The pain, it does not mean that something is wrong. The pain means things are healing and you're trying to improve the function of your new joint. When you are discharged from the hospital, you will have some medications to help with pain, but there are also other things you can do to help manage your pain at home. One is to ice the surgical area multiple times a day, stay hydrated, balance your rest and activity. Don't overdo it. You should do a little bit more each day, but don't double or triple how far you're walking. That can be too much. Distract yourself, such as music, television, reading, even meditation. If you should need refills on your pain medication, you can contact our office, but it may take a couple of days to get results. It often takes 48 to 72 hours to refill a prescription. So please plan ahead, especially if there is a weekend coming up or a holiday. Keep track of your medications using our medication tracker form on the back of your book. Prescriptions can be sent electronically to your pharmacy. Protect your medications at home so they do not fall into the wrong hands. These medications can be hazardous to another person, such as children, pets, and you don't want to lose your medication. Keep the cap securely on so that you don't accidentally spill them and lose your medicine. Keep your medicine in a safe place so you can always remember where it is. When you are finished taking medications but still have some left over, You probably don't want those sitting around the house. It would be best to dispose of them in a proper location. Please do not flush them down the toilet, as this is bad for the environment. There are medication disposal sites throughout the community, such as sheriff and police departments. There is a medication disposal box in the front lobby at Skagit Valley Hospital in Mount Vernon. You may keep the medicine in their original container, but remove your name from the label. Our physical therapy staff will see you every day in the hospital. They will work on range of motion for your new joint, how to safely get up and down from a chair or get in and out of bed, how to maneuver safely in the bathroom, walking, and do stairs if that's what's needed at your home. With hip replacement patients, there are certain positions that are not allowed after surgery. The new joint can dislocate, meaning the ball will pop out of the socket if you do the wrong position. These are called hip precaution positions to prevent dislocation. Depending on your surgery, will determine which precautions are right for you. Your physical therapist will go over those every day that they see you. There are a few simple exercises that you will do after hip replacement surgery, but the most important one is walking. Knee replacement surgery tends to be quite a bit more painful than a total hip surgery. You will need to work on bending the knee, fully straightening the knee, and doing exercises to make the muscles above and below the knee strong again. You will also work on walking. Every time you bend or straighten it, it will hurt, but you need to do it anyway. Your goal for your first post-op visit 2 weeks after surgery is to bend the knee 90 degrees. Your therapist will teach you many exercises to do at home. Some you will do lying down, some sitting up in a chair, and some standing. You will start outpatient physical therapy the week following surgery. You will be given the order for physical therapy at your pre-op appointment. It is your job to have these appointments scheduled and ready for after your surgery. We'd like you to schedule for twice a week for a month after surgery just to get started. You will see your surgeon at 6 weeks following surgery and get x-rays of your new joint. After surgery, you're going to need some help getting around safely. We recommend a front-wheeled walker. This walker has wheels in the front, but skids or tennis balls in the back. Now, if you have a dog that likes tennis balls, you might want to go with the skids instead, so they don't think you're going to want to play every time you get up with your walker. There are 2 sizes of walker. This is a standard size. You should be able to fit inside of it. If you're wider than the walker, then you need what's called a bariatric walker, which is a bit wider. The height of your walker is adjustable. You want to have a slight bend at the elbow when your hands are resting on the handrails. You should be able to fit in your walker with your hands in that position. You don't want to be behind your walker. This is bad posture and increases the risk for falling. You don't want to feel that you're too short for your walker and have to walk on your tiptoes either. Slight bend and nice upright posture. When walking with your walker, it will move along with you, and when you stop, it will stop. If you have a walker with wheels in the front and the back, that walker can get away from you. Remember, after surgery, you're going to be on a lot of medications. They can slow down your reaction time. We don't want you to fall after your surgery and land on your brand new knee. So we recommend a front-wheeled walker. When you're walking well enough, you'll transition from a walker to a cane. Now, if my left leg had surgery, the cane is going to go in the right hand. The cane goes in the opposite side to give you a wider base of support. If you put the cane on the same side, you're only giving yourself 2 more inches of support. With normal walking, left foot is forward, right hand is forward. This teaches your body normal walking mechanics, but gives you a little bit of stability and a little more hands-free than the walker. It's a nice transition to walking independently.